As the numbers continue to rise in Ohio and across the country, health leaders are watching a new variant called Mu.
Our senior health correspondent, Monica Robbins, here now to answer our questions about this, as she is each and every day. I know you've been getting a lot of questions about this. Should we be concerned?
You know, Mu is now the 12th variant that has been of concern or interest. So the Centers for Disease Control and the World Health Organization break down the mutations into 3 categories: variants of interest, variants of concern, and variants of high consequence. So let me calm you down first. There are no variants of high consequence at this time. That would be a variant where there's no treatment whatsoever to work against it. Currently, though, the WHO lists Mu as a variant of interest. It means it's being watched closely because the genetic changes may make it easier to spread and cause more severe disease, and it has the potential to evade the protection of vaccines or even the natural protection from a previous variant, meaning antibodies from a previous COVID infection couldn't fight it either. So while Mu has been discovered in 49 states, it hasn't been able to make a dent in cases like Delta. Nearly 96% of all the new cases in the U.S. are Delta. Delta is a variant of concern, as is Alpha, Beta, and Gamma, but Delta is by far the most prevalent. So for perspective, Delta was first discovered in India last December. Then it became the predominant strain nearly around the world in just 8 months. Mu has been around since January and hasn't reached the concern list yet. So there are 4 variants of concern, 5 variants of interest being watched around the world. Mu is just the latest to be added to the list. So no, let's not worry yet. Let's calm down, because this is what viruses do. They mutate.
Well, we talked about this because I was like, wait a minute, we're missing some of the Greek alphabet.
Yes, we are.
Because we had Alpha and, you know, where'd Lambda go? What happened to Sigma? I mean,
we haven't gotten to Sigma.
How is this going? Well, I mean, how is this going? And, you know, where does Mu even come from? Like, where are we in all this?
Okay, so remember, they used to name the variants by location. Now they're using the Greek alphabet. Mu is the 12th letter. So that's how many variants have been of interest or concern. 3 have been already taken off the list, but there are at least a dozen more that haven't even been named yet. And that doesn't include the subvariants, meaning the subtle changes in a variant that's not enough to make it completely different. Remember, though, this is what viruses do. They mutate to survive. So let's not get caught up in worrying about everything yet. Just protect yourself, and we all know how to do that with vaccination, mask, hand washing, and social distancing.
It's a bit like the hurricanes. You don't want to get too deep into the alphabet because you know it's been a bad year if you do.
Exactly.
It's the same with this. Let's hope we don't get to Sigma.
Right.
But I mean, we don't
or
know.
Omega.
We don't know where it's going at this point.
Well, here's my take, just from all the research I've been doing right now. My guess is that the next variant we're going to need to be a little worried about is a subvariant of Delta, because Delta is so transmissible.
You're right.
So I think Delta is definitely the one we all need to be worried about and the one we need to watch, because that's what's putting people in the hospital right now. And the vaccines do work against it. If you're vaccinated, you don't get as sick. So, and we also know the tried and true methods are better at it than anything else we have.
Sure.
So that's what, you know, we know what to do. We just need to do it.
There she is, Monica Robbins, joining us live here on the What's New set. Thank you so much. Keeping us in perspective for sure. Appreciate it, Mon.